Everybody has their own preference, so ask your orthodontist and see what is best for you. And remember, if I have one message, this would be this. Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and it is my weekly goal to try to inform you to make you the best patients possible. So today we are going to be talking all about retainers. This is super important whether you finish braces, Invisalign, lingual braces, any type of tooth movement. You want to make sure those teeth stay nice and pretty. So let's go over the different types of retainers. What are the main types of retainers? So I think there's a bunch of different, but mainly 3 types of retainers. You have the more kind of old school, old fashioned Hawley type retainers, and those are the ones you probably see on TV when people are trying to show that they have retainers and they're trying to be a little funny. And that is with the metal bar in the front. So the metal bar kind of acts like a little retainer on the front surface of the teeth, and on the underside or the back side or where the palate or where the tongue is, you have something called acrylic. And that can be all sorts of colors. That can be red, blue, purple, anything you want, you can have on the kind of backside there. That is called a Hawley type retainers. There are multiple different types of Hawley type retainers. The overall thing is a metal bar in front, acrylic on the back. And I think these work pretty good. You know, they've been probably the standard of care for the longest amount of time, and they work really well. I don't like them as much as the next one I'm going to talk about, but they're pretty good. But the reason I don't think they're the absolute best is because when you think of it, the Hawley type retainers have a piece of acrylic on the back part and metal on the front part, and they kind of squeeze the teeth to make sure they don't rotate and go up and down and all that stuff. They're good, but I do not think they're quite as good as these guys right here, which you can probably barely see, but these are Essix or kind of Invisalign style retainers, and they're super clear. When you put them on, you basically can't tell you have them on. I think those are the best kind. Why do I think that? Because number one, I think it's easy to clean. It's easy to clean with Hawley retainers, and it's also easy to clean with these type of retainers because you take them out, brush, floss, boom, just like normal, which is not gonna be the same as the next one I'll talk about. But they are good because they're clear as well, so you can't really tell you have them on. So for some reason, you have to wear these things all day, every day. Not the end of the world because nobody can really tell that you have them on. The other good thing is instead of just kind of having this piece of acrylic on the backside and this metal bar in the front, which you have in Hawley type retainers that are kind of just holding the teeth together, instead of that, you have this piece of clear, strong plastic that is holding the whole tooth. Like kind of almost 360, but holding the whole tooth together so it prevents it from rotating, going up and down, and all that good stuff. That's what I like the best, and that's what I use. I think this holds things really well. There is an exception. If you've had an expander, and that's something where we put it in your mouth and we expanded out your teeth to make sure your bite is nice and pretty. I think with those ones, a Hawley type retainer is better, and this is why I think about this. We are doing this expansion, right? You're expanding all the top teeth, and it is actually really hard to keep that. If you use just an Essix or a kind of Invisalign style retainer, you may not be able to hold that width. But with acrylic is gonna hold. Acrylic's like not moving. So if you have a width issue, sometimes those Hawley type retainers are better. So if you've had an expander, you may wanna ask your orthodontist, hey, I know maybe you give me these clear retainers most of the time, but do you think I can get a Hawley type retainer? Do you think that's better for me? And it is, sometimes it isn't, depending on how you want the teeth to kind of shape in together. But I think if you're doing something with expansion, a Hawley type retainer might be better. The third type of retainer is a permanent retainer. And that is something that goes on the inside of the teeth, so you can't really see it. But why is this not my favorite type of retainer? Kind of 2 main reasons. One reason is that it is very difficult to clean. It is basically like having braces, but on the inside of your teeth. So just like you have those floss threaders or that super floss or whatever you did to try to keep those braces clean, you're gonna do the same thing with that permanent retainer. So it's tough, it's tough to get in there and make it all nice and clean. If you have one, if you've had one, or if you know anybody that has, you know that when they come to get a cleaning, that is probably the number one issue that the hygienist or dentist talks to them about all the time, is you get a ton of buildup on those permanent retainers. So that is why I don't love them. But if you're not gonna wear a normal retainer where you take in and out, of course permanent is gonna be a better option than basically nothing. But I don't love them for that specific reason. The other reason I do not love them quite as much is because they have a tendency to break more than other type of retainers. So imagine, I'm sure if you had braces, if you've already gone through a braces journey and you're watching this because you're looking or wondering about retainers, You probably know you've probably broken a bracket or two. And when I say broken a bracket, that just means it came off your tooth. It doesn't actually kind of smash into pieces, but it comes off your tooth. So if you've done that even once while you had braces, you basically have that same opportunity when you're doing your lingual or your permanent retainer. So just imagine that if you break it off, then all of a sudden you have nothing supporting those teeth, and they're gonna go crooked again. Even if you break off just one or two of the teeth of the glue that's holding on to the lingual retainer or that permanent retainer, it has the ability to relapse again. So if we do permanent retainers, we will also give you one that you take on and off just in case. So if something breaks, boom, you have a backup. I still just think it's very hard to clean, so I don't have one. My wife doesn't have one. None of my friends have one. That's why I don't think permanent retainers are great. But like I said, if you're not gonna wear the normal type retainers, then permanent is obviously better than nothing. All right, so you have your braces off, you have your Invisalign off, you know a little bit about retainers. What are you gonna do with them? How much are you gonna wear them? How long you're gonna wear them for? Let's talk about that a little bit. And I am constantly surprised that people don't know this, especially if they've had braces before. But retainers, no matter what you use, is a lifelong commitment. All right, so I always tell patients, wear your retainers as long as you want your braces, or as long as you want your teeth straight. So if you only want them straight for a year, only wear your retainers straight, or only wear your retainers for a year. But if you want them straight for the rest of your life, think about wearing retainers for the rest of your life. And it's not like you're gonna wear it every single day, 24/7, all that good stuff. No, that is not how we do it. Here, for me, my protocol is you're gonna wear it every single night. I say 12 to 14 hours every single night for 2 years. After those 2 years, then you're gonna wear it like once or twice a week forever, ever. And why do I say, hey, only 12 to 14 hours where other people do full time? Because there's studies that show that 12 to 14 hours is a good enough amount of time to keep your teeth straight. That being said, some people's teeth love to move faster and relapse more than others. So if you notice that your teeth are moving faster, you're like, I feel like, I take off the retainer and 2 hours later, my teeth are shifting a little bit, then wear them more. There's no such thing as wearing your retainers too much. You cannot wear your retainers too much, so don't worry about that. If you feel like your teeth are shifting, just wear them more. So what do I say? After the first 2 years, I've seen the patients, everything's going good, they're wearing the retainers. I kind of send them on their way. If they need to come back for something else, cool. But how I tell them to wear the retainers is this. I say, cool, you've gone your full 2 years, everything's looking hunky-dory. What do we do now? Now you are your own orthodontist. So I tell them, hey, if you go for 2 days without wearing your retainer and you put it back in, and it doesn't feel like anything's really happening. It feels like my teeth are still in the same position. I don't feel like anything's tight. It all feels pretty fine. Then I tell them your teeth are pretty stable. You may be able to wear your retainer only once a week after that first 2 years, just once a week, just to maintain, that's it. But if you are like me, and after you do not wear your retainer for a couple days, you put them in, and the next morning you're like, oh my gosh, my teeth are sore. You are one of those lucky people whose teeth are still shifting and still moving a little bit more than normal. And that's just life, that's just how it goes. So you will probably have to wear your retainer a little bit more than most people. So for me, I'm wearing like twice a week, but I'm gonna do that forever, ever, as long as I want my teeth straight. I got my braces off multiple years ago, forever ago, but I still wear my retainer, a couple nights a week. So there you have it. That is Retainers 101. And this doesn't matter if you are 8 years old and just got your braces off, or you're 90 years old and just got your braces off. If you did Invisalign, if you did braces, clear braces, lingual braces, it does not matter. Retainers are pretty much the same for everybody. Remember, there's just 3 types. You got the suck down, kind of like the Essix style. You got the Hawley style, and then you have the permanent style retainer. My favorite is the Essix or the Invisalign style retainer. I just think they're the easiest. It's clean, it looks good. It's just keeps the teeth the best. I think that is the best option. But everybody has their own preference. So ask your orthodontist and see what is best for you. And remember, if I have one message, this would be this. Retainers are a lifelong thing. Remember this, retainers are a lifelong commitment, okay? You spent a lot of time and money, or your parents have, or somebody has, to get to this point. So do not mess it up by not wearing your retainer. If you forget to wear your retainer and you try to put it back in and it is like unbelievably uncomfortable and you cannot wear them, then go back into your ortho, get a new retainer so your teeth do not shift more. What is the worst thing you could do? The worst thing you can do is you do not wear your retainer for a couple weeks and you try to put it in, it doesn't fit. And so you go, screw it, I'm not gonna wear these things ever again. Your teeth will shift back for sure. And then you're gonna be coming seeing me or your orthodontist or somebody, and you're gonna need braces again. And this happens every week at our office, probably actually every day when we're seeing adults. So many people have teeth relapse, so do not do that. All right, guys, so once again, Dr. Nate here with Thrive Dental and Orthodontics, trying to inform you, trying to help you guys out along your orthodontic journey. You know I'm putting out videos every single week, so please subscribe. As you know, I'm trying to answer all your comments as well, so please leave them below, and I will see you next week.